This is Emily Walker, MedPage Today, reporting from Washington. I'm across the street from the Capitol building at the Association of Reserve Officers building, where HIV, AIDS, and TB researchers and advocates met today to discuss efforts to combat HIV, AIDS, and TB on a global scale. Dr. Anthony Fauci, the director of the NIH's National Institute of Allergy and Infectious Diseases, discussed the twin epidemics of HIV and TB.
33 million people infected with HIV, 1/3 are co-infected with TB. It's the leading cause of death among HIV-infected individuals worldwide. We know from a number of studies, TB accelerates HIV replication and vice versa. The critical issue in the co-infection with HIV and TB is the coordination between TB and HIV programs. We've got to do that, and we are doing it.
After the presentation, I spoke with Mark Harrington, who's executive director of the global advocacy group Treatment Action Group, about how funding for HIV, AIDS, and TB is not keeping pace with the demand for these treatments.
But right now we're facing a budget that's about it's over 6 and under 7 billion in the president's budget for next year, not only just for HIV, TB, and malaria, but also for maternal child health and neglected tropical diseases. Now, we think that that's a very important expansion, and that we support it, because in order to achieve global health targets, we really need to cover those bases. But the resource amount that we have is insufficient to meet the vision in the President's global health initiatives. Now, I have no doubt that if the global economy comes out of the recession, that President Obama and the Congress would look kindly on a possible expansion of global health programs. But I think it would be tragic if after trillion-dollar bailouts for banks and the private sector in both the U.S. and in Europe, at €1 trillion bailout, that 27 million people would die of AIDS in the next decade, 18 million would die of TB in the next decade, and 5 million would die of HIV-related TB in the next decade, just because donors didn't feel like putting up the money that could save their lives. What we're trying to do here is to affect the mood in Congress and the administration about continuing to scale up, even during the recession, is the right thing to do. We're one global community, and if we don't deal with all these diseases, they will come back to haunt the next generation and the generation after that. And so we have an obligation to ourselves, to our communities, and to the future to deal with them now with the best tools that we can, and to invest in science to make those diseases go away.
From Washington, this is Emily Walker, MedPage Today.